Hello guys, welcome to another episode of Wellness and Lifestyle. It's your preventive nurse, Nesaba. November is World Diabetes Month. It is a month set aside to create awareness about diabetes. So in simple terms, what is diabetes? It is when your body doesn't make enough insulin, or when your body does not use it as well as it should. So diabetes is a group of diseases that result in too much sugar in the blood. That's high blood glucose. So we are coming to look at the types of diabetes. So the main types of diabetes is type 1 diabetes, also known as diabetes mellitus, type 2 diabetes, and gestational diabetes. Gestational diabetes is when you are pregnant. That's when you have the gestational diabetes. Type 1 diabetes is a condition in which the pancreas produces little or no insulin. Type 2 diabetes is a condition that affects the way the body produces blood sugar. So the most common type of diabetes is the type 2 diabetes, and it's usually in adults, while the type 1 diabetes is less common. About 5 to 10% of people with diabetes is the type 1 diabetes, and currently no one knows how to prevent the type 1 diabetes. Type 2 diabetes can cause serious damage to the body, especially the nerves and the blood vessels. So factors that contribute to type 2 diabetes, that's overweight, being obese, then not having enough exercise, then genetics, that's any family history of diabetes from a mother, a brother or a sister, or any member of your family. So early diagnosis is very important to detect diabetes. So regular checkups, then regular blood tests, that's checking your glucose level. So some of the risk factors are we are still on overweight, then age 45 years or older. Some even say 35 years, so it depends. Then having a member of a family being diagnosed of diabetes, then not being physically active, and if you have ever had gestational diabetes during your pregnancy, or you give birth to a baby who weighs 9 pounds, then liver disease, hypertension. If you're an African, automatically you are prone to diabetes. So someone will ask, that sugar cause diabetes? We all know sugar doesn't directly cause diabetes, but you are more likely to get diabetes when you are overweight, when you take food and drinks that contains a lot of calories. Food that raise the risk of diabetes: ice cream, processed or red meat. Example of processed or red meat: beef, lamb, hot dogs, pork, sausages. Then we have sweet beverages. Example of sweet beverages are soda and fruit juice. So soda and fruit juice contains sweetened, which cause unnecessary weight gain. Then we have white rice. So white rice is also high in glycemic index rating. Cut down refined carbohydrates. Example, white bread and potatoes. So at what age can a child be diagnosed of diabetes? So the first one is a child from 4 to 7 years, and the second one is a child from 10 to 14 years. But signs and symptoms can appear speedily in children. So suddenly the child may have the increase of tests, then frequent urination, then bed wetting, even when the child was not wetting the bed previously. So preventive measures of diabetes. So one, you have to eat healthy, eating food that are rich in fibers. That's oats, we have whole grains, we have brown rice, we have wheat. Then you also have to do physical activities. You can go for jogging, swimming, brisk walking at least 3 times a week. And then you have to be conscious about your alcohol intake. Then you have to quit smoking. How diabetes can be controlled. You aim at 30. Simply means 30 minutes of your time, 5 days per week. So you engage in any physical activity that you can do weightlifting, you can do dancing, you can go for swimming, you can go for jogging. So every 30 minutes, that's 5 days in a week, you can do something. Not something tedious, but something flexible that you will enjoy doing. Then watch your portion. That's not avoid eating large portion. You have to eat bit by bit. Eating too much food at a time has shown that it causes high blood sugar and insulin levels. Then you drink water by replacing your beverages that contains sugar, then preservatives, to drinking of water. That will also help control your blood sugar and your insulin level. Then you cut down sedentary lifestyle. Eating of fast food, rich food, you have to cut down. Sedentary lifestyle. Then it is time to get moving. November is Diabetes Awareness Month. Diabetes is real. It's getting hold of a lot of people. Early diagnosis can help you detect diabetes early. Don't forget to get regular checkups and blood tests. Be smart. Eat smart. See you on our next episode on wellness and lifestyle. #better choices for healthy lifestyle.